Hey guys, today we're going to be talking to y'all about ostomy surgeries. I'm Molly and this is Emily, and she's about to tell you guys what an ostomy surgery is.
An ostomy surgery is a surgical procedure that reroutes the normal movement of the intestinal contents out of the body when the bowel is diseased or removed. Creating an ostomy means bringing part of the intestine through the abdominal wall so that intestinal contents exit through the abdominal wall instead of through the anus. Ostomy surgery may be temporary or permanent depending on the reason for the surgery, and the person's going to get general anesthesia during the procedure. There are 4 types of ostomy surgeries. They are ileostomy, colostomy, ileoanal reservoir, and continent ileostomy. Molly, why would a person need ostomy surgery?
A person may need ostomy surgery if they have cancer of the colon or rectum, an injury to the small or large intestine, an inflammatory bowel disease, a bowel obstruction, or diverticulitis. The preparation for an ostomy surgery begins a few days prior to the procedure unless the surgery is being done on an emergency basis. Most patients have undergone some type of scope or barium enema to diagnose the underlying disease. Prior to the operation, blood tests, a chest x-ray, and an EKG and an abdominal CT scan may be ordered.
As the nurse, it's your job to provide emotional support to the client, reduce their anxiety, promote rest, relieve any pain they have, manage the skin and the stoma, maintain fluid intake, maintain optimal nutrition, and prevent skin breakdown. You can do that by consulting a wound ostomy continence nurse. The nurse should also teach the patient that certain medication forms are more suitable to people with ostomies. These include prompt-acting formulas such as solutions, suspensions, gelatin capsules, and uncoated tablets. Teach the patient to avoid enteric-coated tablets, extended-release tablets, or very large tablets because these are designed for gradual absorption along the large intestine.
As the nurse, you should also instruct the client to seek immediate care if they experience continuous nausea and vomiting, a dramatic change in their stoma size, shape, or color, continuous bleeding at the junction between the stoma and the skin that does not stop by applying pressure, an obstruction, prolapse, or narrowing of the stoma, a deep cut in the stoma, no output of intestinal content or stool from the stoma for 4 to 6 hours with cramping and nausea, severe diarrhea with risk of dehydration, and excessive bleeding from the stoma open.
Alright guys, that concludes our commercial for ostomy surgery. Thank y'all for listening.